Well, of course, all of this comes as more Americans are being tested for the virus, about 1.5 million people per week. And while testing clinics are trying to keep up with that increased demand, if you've tried to get a test lately, you know it is very difficult to do so. So let's bring in Dr. Susan Bleasdale, Chief Quality Officer for the University of Illinois and Health Sciences System. She's here not to only talk about the reported testing shortage, also the latest recommendations from the CDC. Dr. Bleasdale, thank you so much for being with us tonight.
Thanks for having me.
Okay, let's start with that change in quarantine recommendations from the CDC. The director saying it's about getting society back to functioning. What are your thoughts on this, doctor? Is 5 days enough time?
So, I think this is really complicated as this is happening so fast and the information is changing very rapidly. I think it's important for the public to understand, check with your doctor about these updates and when to release from quarantine. I think that the part about this, there's been a lot of focus on this day 5, but it is still with a requirement to mask around others for another 5 days. And so this is a balance, and it's also focusing on the fact that masks work. And so wearing a mask, you can resume activities as long as you, again, consistently mask around others. We want to make sure that people that right now are infected with COVID-19 do not unmask and plan to gather with others for New Year's Eve. Don't plan to go see their grandmother and grandfather unmasked, because that's a risk, because this is a highly transmissible variant. But in the right settings to maintain our society and the functioning of our economy, we can do this safely with the addition of masking. And so people are still essentially in isolation, but that is because they're going to continue to mask around others. So that's really, I think, important with this updated message.
Right. Let's not get rid of the masks. Let's talk about that caveat that Evan mentioned, maybe the requirement of a negative test to come back. Now, that was not something that the CDC included in their new guidelines, but do you think that that's maybe something that will be tweaked?
I think it is something that will be tweaked. The CDC updated the return to work for healthcare personnel on the 24th, just recently, and required a testing for return to work and shortening that isolation period. And so really what's important is that this is nuanced, and that the ability to come out of isolation is related to the individual and their symptoms, because it's important that they are asymptomatic when they are released from home isolation and with masking. It's important to understand the health status. If this is someone that's immune compromised and infected, they may shed for longer. It's important to understand their vaccination status. And then it's also important to understand where they're going to be. Are they going back to a work setting that has people that are very compromised? And that's why I think there's nuances that will be tweaked over the next day. But the important part is that people right now that are actively infected with COVID-19 should just not go out at day 5. They want to make sure that they're still using precautions and still using their masks and still being careful not to be around those that are very highly vulnerable, even though they have been fully vaccinated and boosted.
Absolutely. Yeah, because there is such a high transmissibility here. All right, doctor, let's talk about that shortage of tests. We've seen those lines wrapped around blocks as people are waiting to get tested. And when it comes to those at-home tests, those are really tough to come by right now. What is your advice to those people who are just struggling to get their hands on tests, thinking, I think I have symptoms, maybe I have it, I want to get tested, but I'm just unable to?
I think the important thing is to recognize there is a lot of COVID-19 going around right now. So if you have symptoms, I think you really need to recognize that it's very highly likely that you have COVID-19. There are some other respiratory viruses that are going around. But if you have symptoms, especially if you are vaccinated and boosted, your symptoms may be very mild, and you can still get it and you can still spread it even if you are vaccinated and boosted. So the importance is, what does the testing change anything? Right now, if you have symptoms, you should not go to work, go to school when school is in session. You should not be around others if you have these symptoms. The testing is really prioritized to those that are symptomatic, and these home tests, as many have been bought up, they are helpful for those that are symptomatic if it's positive. However, if it is negative, especially in those that are vaccinated, you may test negative initially. And so it's really important that don't rely on a potentially false negative test and then go out without precautions around others. So
And then, then spread it, right?
yeah, and then spread it. And so it's really important. Testing is helpful, but it really isn't that critical right now. If you have symptoms, stay home.
Just stay home.
And don't go to the emergency room to go get tested if you don't need care, right? If you just need to be tested, don't go to the emergency room. The emergency room is where people need to go that need to be assessed if they need a higher level of care. So I think it's really important. Just stay home and use your mask around others.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.